the other tools here in Explorer submodule that we use for segmenting different kind of anatomies are more or less based on the software's capability of automatically recognizing the border between the anatomy of interest and the surrounding tissue. What if we would then have anatomy, for example, let's say a tumor inside the soft tissue that we can well see with our own eyes, but that doesn't have a clear enough grayscale value difference with the surrounding tissue, so that we don't, for example, manage to use this region grow tool for segmenting it. For those cases, we can use this manual segmentation tool. So let's use a little bit of imagination, and let's assume that we would have some tumor here when we are browsing through these slices. So let's say that this would be the first slice where we would recognize a part of our imaginary tumor. So it would start here. We could then activate this manual segmentation tool, and we could manually draw here. So on any of these slice views, we could start drawing our manual segmentation. So we could draw the first cross-sectional area of our volume of interest by defining this outline. So I'm just clicking with my left mouse button in order to determine this area. So clicking with left mouse button, and I can finish by clicking with right mouse button. So now the first outline was added here in the manual segmentation tool dialog. I could then browse to the next frame. So if I would like to make a very accurate segmentation work, I could also move between the frames by clicking on this small arrow here. So then I would basically be moving to the next slice, and I could define here how the outline of our anatomy of interest looks like. So now, as we see, it's the frame just next to the frame where we first defined the outline of our anatomy of interest. If instead I would do a little bit rougher segmentation result, I could just move the slider in order to move to the next slices. So I could browse through the slices and mark the outline of the anatomy of interest on as many slices as I would like to, as many slices where I can see the anatomy of interest. And finally, let's assume that here we would see the tumor for the last time. So let's finish here. So we need at least 2 outlines defined, and based on those we can create the region. So when we have defined the outlines of the anatomy of interest on as many slices as we would like to, let's click on here on create region, and the segmentation was done based on the outlines that we defined. So now here we can see the volume of the anatomy that we just defined here. Maybe let's maximize this 3D rendered view. So there we can see our imaginary tumor that we just defined based on the outlines of this anatomy on different slices. So this volume here was calculated based on the outlines that we drew with this manual segmentation tool, and here we can see the volume. So with this tool we can understand the position and know the volume of some anatomy of interest that we couldn't extract using the other tools.